Welcome to Reflections, a program where we discuss values and virtues for the transformation of the individual and the society at large. I am Father George Ehusani, and I have with me again in the studio Dr. Anthony Okeregbe. You're welcome, Tony.
Yeah, thank you, Father.
Dr. Anthony Okeregbe is a philosopher. He's in the Department of Philosophy, University of Lagos, and he is interested in the African context. And in recent times, he has taken interest in the mental health of Africans and mental health of Nigerians, especially after his stint at the trauma healing program of Terra. He has taken serious interest, and I was very impressed when I saw that you even applied for and got a grant from Edinburgh, University of Edinburgh, to study the Terra trauma healing program and its contribution to peace.
Peace initiative.
Peace initiative. Wonderful. Am I going to have a copy of that?
I've done the research. Now
you have not put together the report.
I've not put together the report, and then after the report, one has to publish.
Yes. So when published, so we can.
Definitely, you will.
Great. Now, this segment, I would like us to discuss. When we discussed the last time, you observed that Nigerians are in a gigantic trauma chamber. And I told you that Father Richard's own summation is that rather than discuss post-traumatic stress disorder, PTSD, that Nigerians should be discussing ongoing trauma disorder, because we have not gone beyond the trauma. Every day we are in the trauma. So we shouldn't be talking of as if the trauma happened 10 years ago and it's past, but that it is ongoing. Now, we also discussed the level of awareness about mental health in Nigeria, and we said it's abysmally low. When you tell somebody that perhaps there is mental health issue here, he will say, no, we don't have madness in our family.
Madness. It's not our portion.
We don't have madness in our family. And when you tell people that, look, we're not talking of madness. We're talking of cognitive dissonance. Cognitive dissonance. And that anybody can suffer any degree, varying degrees of cognitive dissonance. You say, no. Go and see counselor. No. Husband and wives are having issues. You say, go and see a therapist. Say, no. It is because it is my wife that is unreasonable. It is my wife that is stubborn. Say, you may have an issue, Why don't you talk to a counselor? No. So the level of mental health awareness in Nigeria is abysmally low.
Definitely.
People know when they have ulcer, when they have diabetes, when they have hypertension, when they have rheumatism, they go and see doctor. But ask people to see doctor or clinical psychologist so that their reasoning, their behavior can be assessed. They are not willing. What can we do in this country? You have been doing research now, and you are coming to a lot of awareness about this cognitive dissonance, our mental health challenges. What can we do, beginning from language, beginning from how we capture this reality? Because if you capture the reality, if you say that people are mad, there will be resistance.
Definitely.
99% of people will say they are not mad. Actually, 100% of people, even the guys on the streets don't accept that they are mad. So how can we begin to raise awareness?
First, thank you very much for that, George. First of all, I want to state here that there have been some considerable breakthrough and inroads in terms of research. Now, I've read works of Nigerian sociologists, psychologists, anthropologists who have done works relating to these. And it is gratifying to know that a good number of them are people from the areas where this thing is prevalent. Northern Nigerian scholars. Yes. So they've done lots of research.
Where banditry and Boko Haram insurgency.
Yes.
Which is now what? 12 years old.
12 years old, yes. So we have, So at that level, I think I want to commend Nigerian scholars who are concerned, who are committed to address this problem. But the thing is that such kind of endeavors are fossilized in libraries and journals. So how many people read journals and things like that?
So how do you break
yes.
it down?
So how does that percolate to the lower levels? You know, somebody criticized university knowledge production as being captured in journals and being read by only 20 people.
Yes.
So you publish something in the journal, it's just the author,
and
the editor, and perhaps one or two experts in that area, and it's gone. So how do we allow this kind of situation, the knowledge produced by this research, to get to a level where awareness can be created generally?
Where the teacher in the primary school can read it,
yes,
and be able to use it when he's relating with children. Where the principal in secondary school can read it,
yes,
so that it is useful in his work.
Yes.
Where the civil servant can read it and it is useful. I mean, I tell you that I have approached some people who are in charge of, let's say, rehabilitation in places, and I'm talking of psychological rehabilitation.
Okay.
And they don't even see the need for, let's say, training of volunteers and professionals in trauma healing. They don't see. I mean, when things happen in Nigeria, okay, they fly in, agencies fly in counselors to counsel people for a week and go. But the trauma is ongoing.
It's ongoing.
So it's not about flying in people who will come and professional counselors, clinical psychology who will come and do counseling and go away. You need to train people in the community that will continue as an ongoing venture.
Yeah, as a matter of fact, that has a way of giving credibility to the whole exercise. If you have your own at the helms there, doing the training, taking you out of that, you journey together out of this gigantic chamber, it is very, very efficacious. So I think one way of creating this awareness is to have a coalition, first of all, not a coalition, people of like minds. A network of like minds who understand, who are aware of this situation, to form a block. That is one.
An advocacy block.
Yes, advocacy block. If we have pockets of these advocacy blocks, then we form a coalition of these advocacy blocks.
Yes.
And gradually we include teachers, community leaders,
school counselors.
Yeah. Training them might be a problem, but it might be a problem. The logistics for training might be...
If awareness increases, then the readiness of individuals and groups and agencies and government departments to support will be more readily obtained. But if there is no awareness, for example, I relate with the Nigerian Psychological Association and their leadership, and I got to know that even to get the psychological profession gazetted by government has been a problem for many years. And in many places, hospitals, every hospital is supposed to have clinical psychology department, teaching hospitals, but that even well-trained medical practitioners, how they view mental health and how they welcome professionals in mental health to be collaborators is still
at the level of primitive competition. Yes, I think that we should try to de-emphasize and discourage that kind of mentality. This is not a competition. It is a coalition, a collaboration to solve a problem.
I mean, many years ago, this is now over 30 years that I studied at Howard University the issue of holistic healthcare. More than 30 years ago, in many parts of the world, of let's say America, that you have the doctor going on ward round. And the doctor goes on ward round in many advanced hospitals with the pastor or imam, with the psychologist, and with the social worker. It's called holistic healthcare. So, I'm talking of the ward round of the doctor. He's not going alone. Because as they see this patient who has ulcer, for example, and is admitted because he has chronic ulcer, the pastor is there witnessing the discussion. The psychologist is there because there is greater awareness today of the mind-body relationship and the link between mind and the issues of thought and what happens to the body. Then the pastor or the imam who is handling the spiritual welfare of this person is also there. And then the physiological person, the medical doctor, they all discuss the patient together. It is not a competition. It is, as you said, a collaboration. So, in this country, it's like we have a lot of work to do. To help government departments, private organizations to take interest. Years ago, I think this is going to like 15 years now, there was a step taken in Lagos to arrest people who are driving one way, if you remember.
Sure.
And as they arrested all the people who are driving one way in one location one day and taken to Yaba Psychiatric Hospital, 60% of them were seen to be people with psychiatric problems.
Definitely.
60%.
Yeah, I remember.
6 over 10.
Yeah.
That shows that we have, and this is long before today's traumatic situation.
Yeah, I think, Father, we have to win our professionals of this, what we call this childish mentality of succumbing to positivism.
Yes.
No, the idea, no, elsewhere, people are doing away with it. We are looking at interdisciplinarity, no, consensus building.
It is more than positivity, it is reductionism.
Reductionism.
Yeah, it's even reduction. Because you are reducing the human being. If the medical doctor is reducing the human being to only collocation of cells, meaning you are taking only one narrow part of this comprehensive reality called the human person. It's reductionism.
It's reductionism. Okay.
You know, so you are saying we need to win people out of
this. Out of this this mentality. Elsewhere, people are doing away with it, and it is so tragic that a country that is seen as a religious society has people who valorize this reductionism. Yes, it's so tragic. The inconsistency. So it means we really have a lot of work to do. First of all, we have to tell our people who aspire for these professions that, look, knowledge production in this area is a collaborative endeavor.
I mean, there is no area that has all the knowledge.
Yes, there's no area, especially when it comes to the human person.
Yes.
Most of the human person.
Yes.
So it is not the positive scientist who defines what the human person is.
No.
It is not. So the religious person, the psychologist also, cannot reduce the human person only to the mental. Who
when they say this person has high blood pressure, you want to do deliverance.
Yes.
You want to do deliverance to deliver him of the high blood pressure. That's reductionism. That's spiritual reductionism, just as the empirical scientist is doing scientific reductionism. So this person who has high blood pressure, there is a body dimension. There is a psychological dimension.
Yes.
What level of stress the guy is carrying, that is part of contributory factor for whatever. Then what is his spiritual state that is making him not at peace?
There's even the cultural dimension, the burden of culture.
Yes.
You know, in my presentation once, I was using the example of, because I was speaking to a set of German scholars, and I was using the example of a successful Nigerian of Igbo extraction who has all girls like me.
Yes.
No? Taking the hangover of his culture.
Yes.
To the place where he is, he does not see himself as a man in quotes.
As a successful man. Because he has 5 daughters and he doesn't have a son.
Yes.
So he's in crisis.
He's in crisis.
Not because
he looks at society, he misinterprets any perception people will have of him.
Yes.
So he misinterprets any snide remark directed at him.
Yes.
So he is traumatized. He doesn't have a complete comprehension of his self-worth, of his dignity.
So
of
that
his
problem is
personality.
coming because of cultural hang-ups.
Yes, definitely. So that is not the case with the German.
No. I mean, the German has 2 daughters and is happy with life.
So for people who want to look at certain mental health situations, beyond the psychological and the physical, they should also look at the cultural. Yeah.
And you cannot look at mental health without the spiritual. I mean, which is why we have our psycho-spiritual institute. Yeah. You can look at it because, I mean, this guy who is having this crisis, psychological crisis, perhaps part of it is that he has some issues with his religious. Perhaps he's he is not faithful to his religious covenant.
Yes. The crisis of meaning.
Crisis of meaning.
Yeah.
Crisis of commitment and fidelity can then lead to psychological breakdown.
Definitely.
So we are a complex interplay of spiritual, psychological, cultural, social, biological forces.
Yeah.
We cannot be reduced
to just one aspect
or compartmentalized.
So what it means, therefore, is that to address this mental health problem, we need professionals who understand this diversity, this multiform nature
of the human reality.
Of the human reality, yes. So that is one. And then see how this can be translated to communities, community leaders, in such a manner that the language will be amenable to the average human person. Yeah.
So we need scholars.
Yes, one.
Who can, first of all, do scholarly work that is acceptable to be published in international journals, but also who are able to break that scholarly work down that is accessible to anybody, the average person.
Yeah. In fact, I'm not even thinking of getting works published internationally to get recognition. I'm more concerned with speaking to ourselves.
Well, I'm saying, you guys have publish or perish.
Yes.
There is what is called publish or perish.
Yes.
So I mean, one, we have to acknowledge that. So for you to become professor, there are certain number of papers you need to. Therefore, I don't mind if you write the high-sounding journal paper, follow APA, and what. But after that, can you put in the layman's language this your research work so that the community leader can understand it and help you spread it? Because if you leave it in that high-sounding thing, then only 20 people may read it.
Definitely.
So a lot of this research you talked about, and I'm happy to hear that a number of people, scholars in Nigeria, have discovered this widespread cognitive dissonance. And are putting it in research works.
Even I've read some PhD projects along those lines. There's a priest from Warri Diocese, I've forgotten his name. I think he is schooled at University of Bristol or Bradford or one of those. And he did a very fantastic job on mental health and these IDPs. Because he went there, interviewed them, interviewed the IDP overseers, those who take charge of social workers there. Yes, and he teased out this problem, this mental health problem. So it is beyond providing shelter. Is basic.
That social is support for people who have just suffered.
You've done all those. What of the guy, the small boy whose parents have been and relatives are
slaughtered in his presence. And he's carrying
this
trauma.
Yes, he's carrying that trauma.
And it's going to be for lifelong.
Yes, for lifelong.
And then what about the minders at the IDP camp, the helpers, the volunteers, the people who are the social workers? They themselves are carrying secondary trauma.
Definitely.
They were not present, but they are seeing the consequences every day. So it's called vicarious trauma, and they are carrying it. What help do we have for them? What help do we have? What is happening with parents? A father today in Nigeria who is not able to be a father, meaning He's not able to exercise authority as a father because he cannot put food on the table. Traumatized. But does he know that he is suffering trauma? No. He often does not know. He knows that he cannot put food on the table. He knows that his daughter or his son is no longer obeying him. He knows that his wife is no longer listening to him.
Yeah.
But he does not know the consequences of all that on him. So how else, apart from this research works, what can government agencies do in terms of raising awareness on trauma? What can government agencies do? What can corporate organizations do?
Yeah, I think you see research. So these researches people get are funded by private and corporate organizations.
Outside this country.
Outside this country. So I think our own people too, our own private organizations, corporate organizations, should also do the same thing.
And individuals that are endowed.
Individuals, they should recognize the fact that this is a social problem. It's a problem. And it is something we have to solve. And for me, that is what education means. Using your know-how to solve problems. So we have to put funds down. Corporate organizations, individuals who are gifted can put funds down for research and then can fund organizations to create awareness, can also inspire journalists, create training for journalists who disseminate this information so that they also may not aggravate the situation by their use of language.
Thank you.
By the use of language. So there should be some level of training that will accord them the wherewithal to respect the dignity of the human person.
I am thinking of some day where our Terra Psychotrauma Psychospiritual Institute will run a program for journalists.
Yes.
I mean, I would like you to be involved. Run a program for people who are in the future section and in the news section to see what impact the reportage of violence. What is the impact on society? What impact the reportage of certain things that are very negative, of even natural disasters. What are the possible impacts? Today, neuroscience has come out with all kinds of discoveries about the impact of these things in the brain. For example, you don't go and watch a horror movie and then you go and lie down to sleep. It's going to be playing in your mind, and you can have nightmares. So it means that those who disseminate information need some training on the impact of the kind of information they disseminate. But how would we reach this people journalism, this citizen journalism, meaning a time where everybody is a journalist now? How are we going to reach?
That is where legislation will come in. Yeah, and that is a very thorny issue, because where do we draw the line
between censorship?
Between censorship and rights?
No, well, it's more of where do we draw the line between self-censorship and government censorship?
Okay.
Because I'm not talking about rights. Yes, rights, we have all the fundamental rights, but there is always the need for self-censorship. And when people do not do self-censorship, can we get to a stage where government authorities need to do some censorship? Which is where the problem is.
Yes. That is a very, very serious problem.
It's a serious problem. And then in between self-censorship and government censorship should be group censorship, where those of us who are reporters can censor ourselves. Those of us who are in the media, because you have the Press Council, you have the Nigerian Press Council, you have the Guild of Editors, you have the various organizations, bodies, newspaper proprietors organizations, so that they can do censorship within their business, rather than wait until the censorship is done by government. That will be a way to go.
Yeah, and I think that will somehow elevate the level, the rationality level of our people, you know, the respect for dignity of the human person, that level of respect for the dignity, I think it will be elevated by such kind of self-restraint.
That still belongs to self-censorship. Self-restraint. Restraint within the organization. Like I said, you know, we were involved in the Guardian together, and like I said, that there are certain pictures that are not by editorial policy. Not taken. So we need to train the citizen journalists also to recognize that forwarding headless bodies, right? Once upon a time in this country, a serving minister died, and people, their family members saw it for the first time with the body on the road in the social media. That is terrible. And that should not, I mean, we should find a way of restraining ourselves. On this note, we will bring this program to an end. I'll be speaking with Dr. Anthony Okeregbe of the Department of Philosophy, University of Lagos, and we've been talking about how do we raise the level of mental health awareness in Nigeria. I do hope that, I mean, there's a lot to say here.
There's a lot to say.
We will have to come back some other time to still discuss this issue of mental health.
How do we even get it across to children?
Yes. And how do we get people to take care of their mental health in the way they live their lives? God bless you.
Well, thank you very much, Father. Glad to be here.
Thank you.